I source local food here at the hospital, just the same as I would at my home. I provide nutrient-dense, balanced foods. I don't want you to feel like we're trying to put you on a diet. I want to show you that you can have good, healthful, unprocessed foods that are full of nutrients, that came from the state, that are fresh, that have more flavor and pronounced integrity, to maintain a process that is natural and wholesome.
Hi, I'm Lisa Mahoney. I'm Food Service Director for Kalispell Regional Healthcare. I've been here for 17 years and I work for Thomas Cuisine Management. I've been with them for 20 years. Anytime we can find a product or food that is minimally processed or not processed at all, that would be our first choice.
Hello, my name is Seth Bostic. I'm the Executive Chef here at Kalispell Regional Medical Center. Worked here for a little over 4.5 years now. We try to put a main focus on local and sustainable purchases as much as possible. Total sales per day is usually around 1,800 meals, all of which have all been hand manipulated and done. And every single plate that goes out here, no matter what time of year, has something that was raised within this state. The food sells itself. As long as you get good quality food in and you treat it right.
Seth has been a leader in that. He's been able to build relationships with many of the farmers, the local producers.
My name's Kaylee. We are here in Arlee, Montana, and Brian and I operate Harlequin Produce. We lease this farm, Common Ground Farm.
We've been farming here for now our 5th year here.
So we are a certified organic vegetable farm. This year we have 13 acres in cultivation with another close to 13 in cover crops. We're members of the Western Montana Growers Cooperative, and we've been members since we started farming.
So my name is Dave Prather. I'm the General Manager of Western Montana Growers Cooperative, a farmer-owned marketing and distribution service. We support a wide range of farmers in Montana, fresh fruits and vegetables, meats, grains, dairy, eggs. With the processed products that we provide for the institutions we work with, we partner with Mission Mountain Food Enterprise Center in Ronan.
My name is Brianna Ewert. I'm the Farm to Institution Program Coordinator at Mission Mountain Food Enterprise Center, part of a nonprofit, Lake County Community Development. We're one of 4 centers in Montana's Department of Agriculture's Food and Ag Development Network, and we also fill the processing gap for local fruits and vegetables. One of the major ways that we increase economic opportunity in food and agriculture is through our Farm to Institution program. Institutions in Montana have a lot of buying power, and so by expanding that market, we increase opportunity for farmers and for food businesses that are so essential to rural economic life.
We are continually looking for farmers, growers, people locally that can produce food. We know where it came from. It's more nutrient dense and better quality products to provide our patients, our community, our coworkers.
Out in the fields, we start usually around 7:30 picking for orders. They move from the field to the warehouse where they get sorted, washed, packaged, then they are picked up by the growers co-op.
We want to be able to provide these great organic products that we get in the summertime throughout the winter so that we can still get things like diced and stewed tomatoes.
Seth, who is a brilliant chef. With his culinary knowledge, he can really help us hone the specifications for the products that we're creating.
What we found recently has been a success is some of the value-added fruits and vegetables that we work with Mission Mountain Food Enterprise Center to create. These are fruits and vegetables that we get in season that are processed fresh when we have them and then cut to specification to the institution's needs, and then we store them frozen and then can deliver them year-round.
The Growers Co-op's ability to get our products into institutions is so far beyond what we'd be able to do as individual farms. We have better selling power and we have a better ability to amass large quantities that institutions need at a reasonable price.
I know where this money is going. We know that we're supporting every other person within the state.
For every dollar that comes into the co-op for food going out, about 76 cents goes all the way back to the farmer. So that's far higher than most traditional distributors, as it were. Our first priority, being farmer-owned, is taking care of our farmers.
Really accomplishes our mission by providing patients with the very best quality that we can and get them healthy. Our mission is to improve health, comfort, and life.
There's really a growing understanding that when it comes to improving our health, social determinants are even more important than clinical care. Do we have strong communities? Do we have equitable local economies? Do we have access to healthy food? Sourcing local food not only provides patients with healthier options, it also provides community benefit by improving those other social determinants. When hospitals fulfill their role as anchor institutions in our communities, they can become centers not just of healing the sick, but of creating vibrant health for all of us.
The least manipulated, the least processed, and the most healthful foods provide for body, spirit, and healing. Food is our medicine.
Looking towards the future, for me, I really think there's quite a bit of room for growth with hospitals purchasing more locally produced food. They're serving food to a tremendous amount of people who need and should have access to really healthy, fresh food. So I think it's really important to keep working on this, and there's no reason that every hospital in the state and everywhere that we service shouldn't have Montana-grown food.
The vision for farm to hospital is as simple as it can possibly be. More. How much more can we utilize local sustainable processing to return food back to what it should be, rather than the institutional dumping ground that it's become, and with processed foods and over-manipulated products that keep price points low and keep flavor profiles non-existent. How much more can we do? When can we do it? How fast can we get there so our bodies can get the nutritional balance that it needs out of it, as well as keeping all 10,000 friends in our mouth happy with great flavors too.